Thank you very much, John. I'm pleased to be here and to welcome you to the 12th Innovation Forum that is associated with our Board of Directors meetings of the Institute of Health Economics. The Institute of Health Economics is a rather unique organization. It was created in 1996, Government of Alberta, by the universities and by the health services delivery system. It's a unique partnership because it brings together government, the health system, academia, and industry in the same room. Quite frankly, I don't think you're going to solve many of the problems we're facing unless we can bring that group together and have discussions and try to find unique pathways to solve major problems. I want to thank our board of directors. They've been very supportive. A number of them are here today. I would ask them to stand if they would for just a minute and will be recognized. We have Vicki Kaminsky. Is Vicki here? I don't know if Vicki's here, but she's coming a little bit later. Lisa Marsden from AstraZeneca. Thank you, Lisa. Trish Bain from Lilly. Supposed to be here. The weather is a little tough on people. John Meddings coming in from Calgary. Jennifer Chan from Merck. I know Jennifer's here someplace. Hi, Jennifer. Doug Miller, see here. Doug Gilpin, I know Doug's here, always. Marcia Nelson. Marcia may not be here yet. Keith Gilchrist, I saw Keith earlier. And Brandon Maines will be coming this evening. It is a pleasure to make sure that we always seem to have a very good turnout for this meeting. For the innovative forums. And I think that it's really trying to bring a number of people in the same room to hear some of the real experts in the field. This time we're talking about health system standards from good intent to the real world application. As you know, that's an extremely important aspect. We can have good plans, but implementing the plans is 90% of the work. It's a real challenge in healthcare to balance the need for consistent practice by informed current evidence, and secondly, having evidence interpreted through judgment when addressing unique patients. Judgment is an important factor in decision making. Delivery of health care is not simply a cookbook, but we use evidence and we use judgment. Individual clinical judgment must be informed as well, and it should be based as much as possible on evidence. Individual teams, healthcare teams, clinicians cannot possibly keep up with all the latest knowledge, and we need platforms to bring knowledge to the forefront. I've learned as the chair of the Institute of Health Economics that the economic principle of opportunity costs is critical in healthcare. You can't spend money twice. You have to use it as much as you can in an appropriate way the first time you use it. And there are trade-offs in healthcare. To provide increasing resources somewhere, you often have to take resources away from another area. We're not able to spend the same money twice. So I think that this will be a very important innovative forum. Our system spends significant resources. It's encouraging to see that there is considerable evidence that in many cases, the best care is actually the least expensive care. We have great opportunities in Alberta to create a dynamic and learning healthcare system. I think that's critically important, that our healthcare system continues to learn. We have single health authority with Alberta Health Services and programs like the strategic clinical networks, the primary care networks, and other investments in research. We are positioned really very well. We can become leaders not only in Canada, but we can become leaders in quality, cost, and access and innovation that is recognized internationally. The key to everything is partnership. We will all exceed much more if we work together. That is the philosophy of the Institute of Health Economics, and I know it's the philosophy of many of you in this room. It's my pleasure now to introduce one of the most valued partners in this whole system, of course, is Alberta Health Services, and Glenn Monteith, the Chief Delivery Officer for Alberta Health Services. And it's hard for me to believe that Glenn has been in Alberta Health Services 10 years, because I remember when he was in industry and coming around and visiting before. So Glenn, welcome. I think you've done an awful lot in Alberta Health Services, and it's a pleasure to have you here representing and bring greetings on behalf of Alberta Health Services.